Welcome to our CommonHealth program, Something to Smile About. This program is all about dental health, and we've invited Dr. Israel Mendoza to be with us and answer some of the questions that came from our fellow Commonwealth employees. Hello, and thanks for being with us.
Hey, Rose.
How often should I go to the dentist?
For most of the patients, 2 visits a year are required. You have your exam and your cleaning done in those appointments. But there are certain cases when you need to go more often, like advanced gum disease or diabetes. In those cases, we recommend 3 or 4 visits a year.
What if it's been quite a while since somebody's been to the dentist because they don't like the sound of the drill or they're afraid of going to the dentist? What advice would you give them?
The first thing that you should do is just call your dentist, set an appointment so you can discuss with him, your concerns. Also, be open about your fear and anxiety. The dentist is going to create a treatment plan for you. So that's going to reduce the anxiety and it's going to make your visit really comfortable.
And how often should I replace my toothbrush?
We suggest to replace it every 3 or 4 months, but it could be done before if your toothbrush is worn already.
Well, there are so many toothbrushes on the market today. How do I know what toothbrush is right for me?
One thing that you should look for is the ADA seal. That means that that product was tested and is safe to use.
Is there an advantage to using a manual toothbrush over an electric one?
With the appropriate technique, both of them are efficient. But certain cases, like patients with disabilities, electric toothbrush is going to be the choice.
Should I use toothpicks?
No, actually toothpicks can damage your gums. You can hurt yourself. You should use interproximal brushes, or you can use the floss to remove the debris in between your teeth.
Well, a friend told me that she recently had implants because she was missing several teeth. And these implants replaced her missing teeth, and she's really happy. But what are implants?
Implants are manufactured anchors that have the shape of a cylinder or a screw. They're an artificial replacement for natural tooth roots. And you can attach to them, single crowns, bridges, or dentures, and they're going to improve, the speech and the chewing capability of the patients.
What are the causes of bad breath?
We have several factors that can cause bad breath. One of them is the diet. If you ingest certain, foods that are strong, like garlic or onions, they're going to be in your bloodstream. And as long as they are in your body, you're going to have that strong breath. At some point your body is going to eliminate them completely, you will be fine. The major cause of bad breath is when our particles of food remain in our mouth. So they are going to decompose, they're going to rot, and they're going to produce a bad breath. In certain cases, medical conditions can cause bad breath as well. So those are like the main causes of bad breath.
And is there anything we can do about it?
A good oral hygiene, is crucial. You have to use a proper, brushing technique, flossing, and don't forget to brush your tongue as well, because those particles can can remain on the tongue, and it's important to clean in that area as well.
Is dental health linked to any other health issues such as heart disease?
Yes, and it's in both of them, it works in these 2 conditions work in a different way. Like in heart disease, if the patient has swollen gums, that is an open door for a lot of bacteria that can enter the bloodstream. If the patient has already, a damaged part of the heart, that bacteria can, migrate and localize right there. It's going to multiply and it's going to produce even more damage to the valves. With diabetes, it's a little bit different. The patient with diabetes, is going to have a high level of sugar, and that's going to produce inflammation of the tissues. The tissues are going to be bleeding, they're going to be swollen, red, tender, and also the patient is prone to get infections.
Well, then, is there anything that pregnant women should know about going to the dentist during their pregnancy?
During pregnancy, there are going to be a lot of hormonal changes, and that causes the plaque to be more aggressive. The same bacteria that in a patient that is not pregnant, won't affect your gums that much. In a pregnant woman, it would be more harmful. So good oral techniques, for brushing and flossing are important, and also regular visits with your dentist.
Is there anything that we absolutely should not do, any absolute no-nos?
Actually, we cannot point just one thing, Rose. We have to, watch our diet, okay? Reduce the amount of sugar that we ingest. It could be in juices that have high content of sugar, or sodas, or, processed food that are rich in sugar as well. So that's important, take care of the diet. The second factor is, like I'm repeating this several times, but this good oral health, which is going to come, with your regular visit to the dentist. And, they're going to diagnose if you have any problem and treat it, properly. And the other thing is your, oral hygiene. You have to brush and floss properly.
Dr. Mendoza, thank you for taking the time to answer our questions today about dental health. And for more information, you can see our website at www.commonhealth.virginia.gov. Thank you very much.